I'm Christine Cannellan for Eyetube TV, and today I'm joined by Dr. Daryl White from Cleveland, Ohio, the Sky Vision Centers.
That's right.
Nice to have you here today, and thanks for joining me.
My pleasure.
Especially in today's tough economic times, ophthalmologists need to offer the best service to their patients to stay competitive. One such patient tool is Eyemaginations, which provides an educational platform for patients to help them understand their upcoming surgical procedures. In the end, the service helps to serve both the patients and the practices, helping to increase efficiencies for the physician as well. So, Dr. White, tell me a little bit about how and why you chose to work with Eyemaginations.
Well, Eyemaginations has a truly unique offering in ophthalmology. Our emphasis is the best possible education we can give to our patients, and we did a lot of learning ourselves about how people actually learn. And one way that some folks learn is by actually having a very visual experience. And if you've been to a doctor's office, it's usually kind of didactic. It's usually the doctor sitting hopefully in front of you, hopefully looking at you and not looking at his computer screen, and telling you what he thinks you need to know or what she thinks you need to know. But a lot of people don't learn that way, and Eyemaginations gives us the opportunity to tap into a totally different way that folks learn through videos, and it's incredibly effective as a learning tool.
Great. I understand that you're now using Luma, which is the newest platform from Eyemagination software. Tell us a little bit about your experience with Luma and how you're using it with your staff and within your practice.
Luma is an incredible leap forward. The original product, the Office product, was absolutely revolutionary, but as with all products that are kind of first-generation products, it was a little tough to use. It was a little kind of geeky and wonky. You really had to learn some tough technical things, or tougher technical things than you really like to do in the office. And what I found with Office was we put a lot of things on autopilot, and there was a lot of work done by the staff. But I found that it was a little more time-consuming than I wished to have when I was actually doing an educational process in the exam room. So with Luma, what we've been able to do is launch it in front of the patient with the doctors in the office and actually use Luma as a very active, interactive part of that educational process with the patient right there with the screen. And I found that it's much easier to move through and utilize the product. Not that the other one was terribly difficult to use, but Luma, it looks like, is going to be a much more time-efficient product for us and allow us to do a better job teaching our patients.
Great. And what is it about Eyemagination software that you find so appealing in your practice? And do you think that other ophthalmologists would benefit from this type of service?
We think that Eyemaginations as a suite of products is an absolutely fantastic resource. People think of Eyemaginations and they think of the in-office product, now Luma, and many practices do really nothing more than loop a continuous video stream in their lobby or their waiting room. We have really done a full dive into the Eyemaginations suite of software. The Eyemaginations Home product, which is a way that we can actually get these videos into patients' living rooms, has actually allowed us to put the front door of Sky Vision right into a patient's living room. And once we're done, the educational process doesn't have to stop, because we're able to extend our front door and the back end of their experience again right into their living room by sending them the Eyemaginations Home product, where they can use and see the Eyemaginations videos right in their own home.
That's great. Now, how do you use the internet in general to educate yourself and to learn about new innovations?
The internet is an incredible repository of information that used to be impossible to gain access to unless you came to a meeting like ASCRS. And what I've done is I've continually searched for people who are smarter than I am, who do things better than I do, and have tried to see what they're doing. Eyetube is a great example where you can actually go find a video of a new procedure, or a new wrinkle on a procedure, or maybe even a new way to use Eyemaginations, upload the video, and do a little self-education. I'm really excited about the possibility of doing the same thing with some of our patient education products, like our Facebook fan page, for example, where we can upload videos from Eyetube as a way to teach our patients about what might be coming with their eye care.
Great. I'm glad that you're using Eyetube too.
It's a great, great, great thing. It's it's incredible how much is out there, and it's
Absolutely.
incredible how great a resource Eyetube has become.
Yeah, I'm so happy to hear that, and I'm sure BMC is very happy to hear that as well. So thank you so much for joining me here today. I loved hearing your thoughts about Eyemaginations, and especially the fact that you use Eyetube.
Hey, you're most welcome. It was a pleasure to be here.
Thanks, Dr. White. For Eyetube TV, I'm Christine Cannellan.